These days, most women know that breastfeeding is best. This DVD, featuring advice from healthcare professionals, takes you through the process of breastfeeding step by step, to help you make informed decisions about what's right for you and your baby. There are many advantages to breastfeeding, not only for your baby, but also for you. Vicky Scott, a midwife and breastfeeding advisor with over 20 years of experience, explains how.
Breast milk's a perfect food for a newborn baby. It contains all the nutrients that the baby will need, and importantly contains antibodies to help boost baby's new immune system. The kind of illnesses that the antibodies will prevent in a young baby are things like stomach upsets, so stomach bugs, colds and ear infections, for example. And then also in later life, it also can help prevent things like obesity and diabetes.
Breastfeeding has many advantages for you too. It helps your womb return to its normal size and reduces bleeding. It can even reduce the risk of serious long-term complications such as osteoporosis and certain types of cancer. You'll also spend less time preparing feeds and sterilising your equipment. You'll be more mobile, and you'll have more quiet time for you and your baby to get to know each other.
I think many mums are concerned that they won't be able to breastfeed their babies correctly, or that they won't have enough milk for them. Breastfeeding in itself shouldn't be difficult, but many mums do find it difficult as it's a new skill that they need to learn. So the first port of call would be the midwife, and after that the health visitor. They would be the first people to go to for help. It's normal to be concerned, but it's really reassuring to know that as long as you breastfeed your baby enough, then you'll make enough milk to feed your baby. It all works on supply and demand.
In the first few days of breastfeeding, your breasts will start producing a creamy yellow substance called colostrum. This is packed with proteins, vitamins and protective antibodies against disease. To latch on correctly, turn your baby's body towards you, chest to chest. If needed, use a pillow for support, bringing nose to nipple, which should encourage your baby to open wide. Make sure your baby gets a good mouthful of the breast, so that your nipple is in the back of the mouth against the soft palate. As the milk comes in during the first week, it's normal for breasts to feel hot and uncomfortable for a few days. Cold compresses applied to the breasts after feeding can be soothing and will help reduce the swelling. If your breasts become engorged, try alternating hot and cold washcloths, or try expressing a small amount of milk to relieve the pain. There are many reasons why you might want to start expressing milk rather than giving it to your baby personally. Regular expressing allows you to catch up on some sleep, go out with your partner or friends, and can help create a wider family bond as other members of the family can feed your baby. This way, your baby can continue to gain all the benefits from your breast milk without you having to be there. It also helps relieve pain and pressure on your breasts and maintain your milk supply. Regular expressing is essential if you're planning to return to work and wish to continue nursing your newborn. Returning to work is no reason to stop breastfeeding. The key to success is planning ahead. Become familiar with expressing milk and sterilising equipment so that there are no sudden upsets when you do return to work. Talk to your employer about having access to a private room. While at work, try to follow your baby's feeding pattern and express milk when you would normally feed your baby. You can discreetly store your milk in the fridge and take it home in an insulated bag with pre-frozen gel packs, which will keep the milk cool. When you first use a breast pump, try to find quiet time when you know you will not be disturbed. Putting on some music and having a photograph of your baby nearby can help. Sit in a comfortable chair with a cushion behind your back and try to relax. A warm compress and gentle massage will help stimulate the letdown reflex. The more milk you express, the more milk you produce. This may only be a small amount during the first few days, but it will increase with demand. You can express milk using a manual or an electric breast pump. Philips Avent offers a wide range of breast pumps, all featuring the unique letdown massage cushion, a gentle pedal massager that imitates the way your baby feeds by gently massaging the area around the nipple to stimulate the letdown reflex. All Philips Avent pumps can be used with either Philips Avent milk containers or with the breast milk storage system using the adapter. With sensitive fingertip control, the gentle vacuum imitates baby suckling for an effective, steady milk flow. You find your own comfort level by squeezing the handle 2 or 3 times in the rhythm you desire. Then you simply touch the control button and the pump continues pumping at the same pace without any further assistance. If at any time you wish to vary the rhythm, press the button again to revert to manual. Show the pump the new desired pace and press the button again and it will take over pumping for you. You're always in control as the buttons on the pump are easy to reach. Try to use the pump by copying the way your baby would suckle. Rapid, shallow pumping to initiate the letdown, followed by deeper, slower movements once the milk starts to flow. Using an electric pump can be ideal if you intend to express regularly or over a long period, as it saves effort and time.
The Philips Avent Airflex bottle successfully reduces negative effects of infant bottle feeding. In essence, feeding using the Philips Avent Airflex bottle provides your baby the same benefits typically associated with breastfeeding. Clinically proven to reduce colic, your baby naturally controls milk flow, mimicking the natural process of breastfeeding. To test whether a feeding bottle design could influence colic or crying, a randomized study was made comparing a conventional vacuum bottle and an Avent non-vacuum bottle. The test was done on 145 healthy full-term infants at 2 and 6 weeks of age. Colic begins at 2 weeks of age and resolves by 4 months of age. Typically, studies have shown that infants in this period cry an average of 2.2 hours per day. Crying for more than 3 hours per day was more prevalent in formula-fed infants than breastfed ones. So what did this trial reveal? At 2 weeks, infants fed with Avent non-vacuum bottles spent more time awake and content, especially at night and in the morning. Less colic was also reported with infants fed with the Avent bottle. Finally, colic duration was also reportedly longer in infants fed using conventional vacuum bottles.